Well, good afternoon. It is my pleasure to introduce to you Dr. David Oppenheim. To some of you, David needs no introduction because this is probably the 12th or 13th visit and grand rounds that he has presented here since the year 2000. And he has been a featured speaker in the 6 attachment and trauma conferences that Alicia Lieberman and I have put together over these past 17 years. But for those of you who have not had the pleasure of seeing and hearing David, he got his bachelor's and master's degrees in psychology at the University of Haifa, PhD in psychology from the University of Utah, and did his postdoc work with Robert, MD, at the University of Colorado. His academic accomplishments are weighty. He has been the chair of the PhD committee at the University of Haifa for several years and has been the chair of the Department of Psychology at the University of Haifa, where he is no longer chair, but wears too many other hats that the chair hat doesn't fit any longer. For example, in the last 3 years, he has been a visiting professor at the University of Cagliari, Italy, the Sapienza University in Rome, and the University of Warsaw. He is on the editorial boards of the following journals: Child Development, Developmental Psychology, Human Development, Family Process, Merrill Palmer Quarterly, International Journal of Behavioral Development, Social Development, and Development in Psychopathology. He has over 70 publications and over 30 book chapters, and he is one of the most delightful people you will ever meet. David.
Thank you, John. I don't know that person you're talking about, but I'm really happy to be here again. Thank you all for coming. Today I would like to talk with you about a topic which is a classic topic for all of us interested in parent-child relations, in early trauma, in parenting, in intervention, and it is about the insightfulness of mothers, particularly mothers who were sexually abused when they were children, and the road of resolution of the trauma as a buffer. And it's very special to speak about this important topic here because of the roots of these ideas that I'm talking about in clinical work, and particularly in the work of Selma Freiberg, who Alicia Lieberman is continuing in her footsteps, developing these ideas about how trauma gets passed on through the generations, and of course the very classic ghost in the nursery idea that I will get back to in a few minutes. So it's moving to speak about these classic issues that are still relevant today from a research perspective. In this particular place, in this particular location, I'm honored and happy to be able to share with you some of our work. This just gives you a little bit of a feel of the University of Haifa, where I come from. I hope you'll visit one day and come to our lab, and I'll be happy to show you around. We are a joint Arab-Israeli campus. 20% of the student body is Arab, and there are some friendships too, as you can see here. I also want to mention my very good friend and colleague Nina Koren-Kari, with whom I do most of my research. And her background in social work and psychology is very relevant. I think Selma Freiberg's background in social work is very relevant. and psychoanalysis. It plays out in this work that we do. And the PhD student, Rachel Getzler-Yosef, on which today's presentation, a big part of it will be based on, who is very devoted to working in particularly with women who experienced trauma in their childhoods, particularly sexual trauma. I also want to mention Patricia Van Horn today. As it turns out, today is, to the day, the fourth Yortzeit, the anniversary of her passing. Patricia, I assume many of you know Patricia, and her important work together with Alicia in the field of child-parent psychotherapy and so on. Very special person, and with very, very special ties to Israel also. And actually, I think the last time we met was having dinner, Alicia, Patricia, my wife, Anat, and myself in Tel Aviv was the last time I met Patricia. And it so happens that today is the Memorial Day of her passing. I mentioned to you earlier, and just a minute ago, Selma Freiberg, who is one of my heroes. I didn't have the pleasure to know Selma, but I think through my close friendship with Alicia, I got to know about her. But of course, I got to know much more of her before I even met Alicia, which was through reading the wonderful things that she wrote. And her very special way of writing was not only what she wrote, but how she wrote. A few years ago, someone gave me this video in which Selma Freiberg speaks of the infant mental health project that she developed beginning in the 70s. Is that correct, Alicia? Beginning in the 70s in Ann Arbor. And this is a video that I use a lot for teaching since I stumbled upon it just a few years ago. It is not kind of well known. I don't know if anyone here has ever seen it. I will show you one little clip in which you can quite quickly get a sense of Selma Freiberg's special way of speaking and thinking. And some of the points that are really profound and carried through so much clinical work and research.
Had the problem. Her mother had a When we first saw Marla at 6 months of age, Marla had spent most of her hours in her crib, alone and unattended. A depressed mother can still read her baby's signs. She is not uncaring, but in the depths of her private grief and isolation, she cannot summon love and joy for her baby. Marla is crying. Her mother cannot comfort her. It is as if this mother cannot hear her baby's cries. How would she know how to comfort? For Marla's mother was once abandoned by her own mother. For Marla, the danger is great. She's a joyless baby. She does not look to her mother or to other human beings for comfort. Developmental testing shows us that she is not performing up to age in certain crucial areas. How can we help Marla and her mother? Somehow we must help these two find each other. Mrs. Adelson and Dr. Zinn have worked together to help Marla and her mother. In 4 months of work, the picture has changed. Here is Marla and her mother when Marla is 10 months old. her mother have found each other, we believe. Marla's mother has found joy and pride in mothering. Marla has received at last her human rights, the rights of all babies to be cherished, to be comforted in pain, to see joy on the face of a partner. Solitude and fear in infancy come children and adults who do not trust, who do not love, and, like Marla's mother, are condemned to renew their tragic stories in marriage and parenthood. If they are among the fortunate, they will bring their nightmares of solitude and terror to the psychiatric clinic and find healing late in life. If they are less fortunate, and these are the larger numbers, they will pursue their empty lives at great cost to themselves and to the human community. But Marla and her mothers, and to many others we know, that the cycle of futility need not repeat itself. For the baby and his parents, infancy is a time of hope and promise.
Okay, sorry about those interruptions, but I think you could still get a sense of the ideas behind what Selma Freiberg is trying to tell us about the intergenerational transmission of trauma. Very strong words. She's not at all cautious about talking about the intergenerational transmission. She expresses a very strong belief in the huge price that can be paid due to these kind of traumas that are passed from one generation to the next. And it is this kind of thinking that struck me many, many years ago, really pulled a chord in my heart and also something in my mind. And my favorite approach to this was, can we actually demonstrate any of this in research? In the world of research. I mean, it's one thing to make these claims and to use them as a basis for clinical intervention, and it's another thing to actually try to demonstrate the validity of elements of this big picture that is portrayed here. The element that I will talk about today is this basic idea that trauma and its resolution has a strong influence on parenting, or at least is associated with parenting. And then when you have resolution of trauma, there's a buffer against its effect on parenting. The other thing that Selma Freiberg's thinking strongly influenced me is this notion of insightfulness, of the capacity of the parent to see things from the child's point of view. Because if you go, this is really disturbing, right? I guess it's coming from the other sides.
It is. In general, and Bernard, please mute your mic. We're getting a lot of noise here.
Okay. Insightfulness. So this capacity to see things from the child's point of view. When you read Selma Freiberg's writing, in particular Ghost in the Nursery, what comes across most profoundly and impressively are these moments in treatment when suddenly the parent, the mother, can actually see the baby. And she refers to it even in this clip that we saw. Initially, when the mother was also very depressed, that it was as if she could not see the baby. And then something happens and the mother is able to see the baby. And it's not really only seeing the baby, but seeing the inner experience of the baby, the motivations of the baby, the emotional experience of the baby. And I thought to myself, wow, that's an amazing capacity. Can we capture that capacity in a research-based tool? This capacity to suddenly see the baby. And that started my colleague Nina and I on this pathway of this thing that we call insightfulness. So we developed a procedure that I'll tell you a little bit about, and we've done lots of research with this procedure that I'll tell you a little bit about, and then we'll take this world of insightfulness into this world of women who experience trauma in their background and see whether there is any association between traumas that you experienced ages ago and your present capacity to see the world from the child's point of view. So I will now talk a little bit about this capacity of insightfulness and review a little bit of that, and then get back to the issue of trauma and its reflections in insightfulness. So when we talk about this capacity to see things from the child's point of view, this quote, well, many people have talked about it, it's funny to call it a quote, but specifically Mary Ainsworth, the mother of attachment theory, described very simply in her first sentence about what is a sensitive mother. A sensitive mother is a mother who sees things from the child's point of view. But how do you operationalize that? What does it mean? So we define or describe four main characteristics of parents. And when I say parents, I mean parents because we've done a lot of this work with dads as well as moms, and also with caregivers who are not parents. What can they do when they're insightful? The first thing is that they have insight regarding the motives underlying the child's behavior. That means that they are able to think about the child's behavior as having motives, reasons, feelings, thoughts, motivations, needs that are under the surface. So many of the parents that we see clinically, less so in normative samples, just look at the surface of the child's behavior, and the idea that there's something underneath it seems foreign to their way of thinking. They're not open to that. Or they describe reasons that are kind of very general and negative, such as those that Alicia described in her writings about hostile attributions. So he does that to aggravate me, he does that to make me angry, he does that on purpose, intentionally, and so forth, rather than to understand in a contextual way what specifically happened right now that may have triggered this behavior or that behavior. That's what we mean by insight. Acceptance has to do with, particularly with challenging behaviors in every interaction with a baby, a child, of any age in fact. There are a combination of behaviors that the parent finds pleasurable or at least consistent with the parent's expectations, but there are also behaviors that are perhaps disappointing or challenging or difficult or not what the parent expects of the child. And that is where acceptance comes in. It's easy to accept behavior that you like or behavior that is easy. It is difficult to accept behavior that disappoints you or frustrates you or aggravates you or is socially unacceptable. By acceptance, we don't mean that the parent necessarily is happy with this behavior, but the parent is thinking about what might the reason be for this behavior. So, and not in a kind of blaming or overly general way. Holding an emotionally complex view of the child means seeing the child, like any other human being, is multifaceted, has many aspects. Some of them are more positive, some of them are less what you would like, but that's who your child is. This is very relevant for kids who have diagnoses. We do a lot of studies on kids with various diagnoses, including particularly autism. So not using the autism prism or the diagnostic prism to understand your child. To understand the child as a child who also may have a diagnosis, but the diagnosis really doesn't explain anything, because I mean we know that under any diagnosis you can have children who are very, very different from each other. So it really doesn't explain much to know that he has ADHD. What does that really mean? It's not an explanation. Okay, so parents who are insightful, in fact, when you read their interviews, the diagnosis rarely, if ever, gets mentioned. It's not really relevant. I mean, you ask them, what do you think happened, what do you think is going on in your child's mind? They explain what's going on in their mind. They don't use clinical diagnostic words to explain the behavior. And finally, very important, openness regarding the child and itself. So what we mean by openness is going back to remember those two concepts from Piaget, assimilation and accommodation. Okay. Assimilation is just taking new information into these old structures that we have in our mind. Oh, we know the child, we know the person, so we take the information and put it in the old schema. So it's more of the lazy operation of the mind. But what about if there's new information? Can you see novelty? Can you see that your child behaved in a way that is unexpected? So for example, a parent might say, you know, when you pulled out that puzzle, I thought, oh, he's not going to be interested in puzzles. He hates puzzles. But actually, he really liked that puzzle. So we had a really nice, we played together with that puzzle. I was really surprised. What a wonderful thing to read, because it means that this parent is actually changing their schema of this child, adapting, differentiating between different situations. And if we want to add a cherry on top of this cake, we might have a parent who might say, I wonder why that is. Maybe because, you know, at home when I play with her, you know, there's always the cell phone ringing, and there are other kids, and the TV is on. Maybe that's why he doesn't like this game. But when I'm actually playing with him in your lab, there's no distractions, no nothing, then he likes it more. So that's, you know, the perfect answer, because this parent is using this as an opportunity to learn something new about her child, something positive, something she might be able to take into everyday life and change. So those are less common, perhaps. We don't expect every parent to do this, but that would be a great example of openness. So for us, insightfulness is the basis for sensitive and emotionally regulating parenting. It's embedded in everyday routines. So this is not an aha moment, a kind of psychoanalytic aha moment where you suddenly understand something. No, this is actually very mundane. This is what you do, particularly with young kids who do not speak very much, but also with older children who may have language but do not always express what is going on inside of them when they come home from school and slam the door or throw the books or whatever. You know, and you're thinking to yourself, wonder what happened to this. Okay, so this is going on. This is what a lot of parents do, kind of intuitively. It's not a very special, unique kind of thing. Both insight and empathy / acceptance are needed. So this is not just an intellectual exercise of thinking about your child's internal experience. There is a cognitive aspect to it, but there's also, this is an attempt to understand on behalf of the child's well-being. So the empathy part is integral to insightfulness. And I'm stressing this because there are parents who have insight and no empathy. So they understand very well, and they can tell you and actually explain the roots for the child's behavior, and they're strongly angry or rejecting or unhappy about this behavior. And that particular combination does exist. And you can imagine from the child's point of view, that might be quite a complex kind of thing to experience. Why is someone understanding me so well and yet angry or disappointed or rejecting towards this difficulty that I have, for example? So maybe I'm having a really hard time separating at preschool because I'm a very shy and anxious child, and my mother or father seems to really understand that shyness is what's driving anxiety, is what's driving my shyness, and yet they're very angry about that. They're really not accepting of it. So that's another form of lack of insightfulness. And of course, insightfulness is not always expressed in ways that are experienced positively by the child. This is a very basic fact of parenting. We do all kinds of things that our children do not like at all, and can be furious about, but you can do it coming from an insightful stance, and then presumably this is something that can help the child's self-regulation and other kind of things. At the moment, he's furious at you for setting a limit, and that is not inconsistent with insightfulness. How do we assess this? So this is the concept, the assessment. We videotape the mother and the child during various kind of activities, playing together, doing a task together, those kind of things, depending on the age of the child. It's kind of a sampling of the child's behavior. And we interview the mother about her child's thoughts and behaviors on the video. So it's based on looking at the video and responding to the video in particular. So we kind of bring whatever is in the mind of the mother or the father close to the actual reality as represented on the video. And the interesting thing about our assessment, I think, is that we don't assess the accuracy of her perceptions. So even though we're showing her the video, you notice that what I mentioned, insight about motives, acceptance, openness, having a complex view of the child, all of these dimensions of maternal thinking or parental thinking are not issues of accuracy. So you don't judge them by looking at what she says, looking at the video and saying she's right or wrong. You actually don't look at the video at all. You read the transcript of her interview and you judge whether or not the parent is showing good markers of these dimensions that I mentioned or poor markers. I'll explain in a minute what it looks like when it's not so good. So this is kind of an interesting thing about our assessment. More of the process in the mind of the parent as the parent is trying to figure out the child, rather than the issue of are they right or wrong about what they're saying about the child. We don't know.
You can ask them to mute the mic. You just tell them to mute their microphone. You can just tell them through the mic. They can still hear you.
He talked through this for some reason. Can you guys please mute the mic?
Yeah, you'd be the only one looking at it. I can keep this covered or they'll just see your face.
Just use the little mic. I think they can do it.
Yeah.
I'd be grateful if you could mute the mic.
I think yours is off.
Does that mean they didn't hear me before because my mic was off?
No, they can hear through the other one.
Oh, okay. All right. We can continue. Let us talk a minute about barriers to insightfulness. So how do interviews of parents who are not insightful, what do they look like? Either they portray the child in an all negative way. This is very kind of reminiscent of what Alicia wrote about quite a few years ago about negative attributions with regards to parents and the psychodynamic processes that might be going on, their projections and so on. But there also could be all positive descriptions. I won't go into how do we exactly identify these in the text. Maybe later if we have a few minutes to explain this. Difficulties maintaining the focus of the child on the child is another common kind of difficulty that some parents experience. You're asking me about what went on in my child's mind. Hard for me to say, but I'll tell you what I felt when I was doing this. And then there's a long description, beautiful, full of psychological insights and everything you want about herself. But the problem was, the question was about the child. So the child is lost in this kind of self-focused speech. It's okay to speak about yourself when you're asked about yourself. It's a problem to just shift the focus to the self when the question was about the child. Insight without empathy, I explained that. Being overwhelmed by negative emotions, so there might be a lot of anxiety about the child or some other concerns. They just overwhelm the parent's response, so they don't respond to what you're asking about. Rejection and hostility with regard to the child, or kind of the other side, which is just lack of interest or curiosity about motives. So that the parent not only says, I don't know to the questions, what do you think your child was thinking and feeling, but doesn't seem to have any kind of difficulty in expressing this lack of interest. So it's not the type of thing like, I don't know, it's so hard to figure him out. I really try, but I never know quite what's going on in his mind. It is like, I don't know, silence. How can you know what somebody else is feeling? Might be a response. Okay, so these are the barriers to insightfulness. In the general population of community samples, we have about 62% of the parents are insightful, and then the different types of lack of insightfulness that I won't go into today. One-sided, disengaged, and mixed. I describe these barriers to insightfulness. They represent these three groups. And but this number, 62%, goes down when the risk of the sample goes up. So for example, in the sample that I'll talk about today, which is mothers who experience childhood sexual abuse in their own childhoods, we will have only 13% of the mothers who are insightful. So insightfulness is about 2/3 when you have low-risk samples. So we have a lot of research evidence by now, I'm very pleased to say, about insightfulness, and I will not go into it in any detail right now, but just give you a little bit of a feel to it. Of course, the first question that interested us as attachment researchers was, is insightfulness associated with attachment? Because that's where we were coming from. And we have quite a few studies that have shown that mothers who are insightful are more likely to have securely attached children. Mothers who are not insightful, of the different kinds of lack of insightfulness, have parallel different types of insecure attachment in their children. And I'm emphasizing this, it's not just a binary insightful, non-insightful linked to secure or insecure, but the different types of insightfulness, lack of insightfulness with the different kinds of insecurity. That is an important point for us, that it's a more refined kind of assessment. When mothers become more insightful in treatment of their children with behavioral problems, this was done in a therapeutic preschool, the children are getting better. When they're not getting more insightful, the children are getting worse. In fact, that's what we found in that study. Other people, not our lab, have used insightfulness for samples of kids with autism spectrum disorder, and they found that, as you might anticipate, the intervention was very effective, but only if the mothers were insightful. So insightful mothers were much better at picking up intervention that improved the sensitivity of the mothers. If the mothers were not insightful, then the intervention to improve sensitivity did not work. So it's kind of a treatment, it's a moderator of treatment effectiveness. I will not go into all of these details except the last one, because I like it so much and it's rather new. When the mothers were insightful towards the babies at age 1 year, at age 16, we saw the babies, now adolescents, and asked them about, or assess their insightfulness with regards to their best friend. So now we're moving from the parent-child relationship to that child, now adolescent, and his best friend. And we did an insightfulness assessment with regards to the best friend. We filmed them and then asked the adolescent, what do you think was going on in the mind of your child, of your friend during this episode? What was he thinking? What was he feeling? And is this typical of him, etc.? The very same questions that his mother was asked 15 years before that when he was a baby. And we found this really nice links across so many years. Amazing. Between the insightfulness you experienced as a baby and the insightfulness you're able to show as an adolescent. I have to say, this doesn't mean that what happened to you as a baby determines what happens in a linear fashion, what happens later on. For the mere fact that it's the same mother that, you know, that we interviewed when you were a baby, who parented you this morning also. Okay, so the parenting continued. So this is not a point about some formative period early on that shapes who you are. But it is a point about something that begins so early on, before the baby is verbal at all, and is expressed years later in a close relationship with someone outside the family. Okay, so this is insightfulness. And now we have to go to the main point, which is what happens to insightfulness in the case of mothers who were sexually abused as children. And the questions, are mothers' traumatic histories reflected in their insightfulness towards their children? It's something that happened decades ago, and now she's a parent to a child. Is this in any way influenced by her childhood experiences? And does resolution of the trauma buffer against its impact on maternal lack of insightfulness? Bowlby wrote about traumatic experiences as follows. Affective experiences that are unbearable for the child are shut off and left unintegrated, but continue to influence thoughts, feelings, and behaviors. It's a basic notion about trauma. Selma Freiberg. As traumatized girls become mothers, this shutting off can powerfully distort the representations of the child and in the mind of the mother and act as a barrier to insightfulness, empathy, and sensitive caregiving. The ghost in the nursery idea. So this is the basic idea of ghost in the nursery in terms of the model underlying it. Has to do with how trauma shapes the capacity of the parent to view the child, to see the child. Like she said in the video, that the mother is not seeing the child. And this is what we want to capture here, and to see whether resolution of the trauma makes any difference. So there's a lot of research, actually not a lot, there is some research evidence about the effects of childhood sexual abuse on parenting. And there's a list here of what some people have found. But almost all of this research is based on self-report of the mothers themselves. And of course, that's a problem from a research point of view. And we like observations and interviews in which we can evaluate rather than the person reporting on themselves. So there is some evidence of these difficulties. So we set out to do a study. We collected a group of 30 mothers recruited from agencies specializing in the treatment of women who were sexually abused as children. And this was our childhood sexual abuse group. Very important to stress how we recruited the sample from agencies serving mothers who experienced trauma as children. And I'm stressing this because all of the conclusions that we can draw from this study are limited to a sample of mothers who found their way into such treatment agencies or places that serve mothers with these kinds of experiences. Is this equally relevant to mothers who are not in treatment right now? Whether is their situation much worse than these mothers? Is it much better than these mothers? Is it similar to these mothers that we see here? We don't know. And I raise this as a question because other research that we've done in our lab, very different from this, that had to do with Holocaust trauma, showed us that the way you recruit samples shapes in a profound way the results that you get. So even though this may sound like a technical thing that should bother researchers and not clinicians, how you recruit, how you get people to your lab. No, in fact, how you get people to your lab to do the research will shape to a large extent the results. And the question how to get people to our lab to do a study like this, not through agencies and other kind of ways where people self-identify themselves, but ordinary people who are out there in the world and happen to have trauma in their background, but do not identify themselves like that. That is the study that I would, love to do, but is of course technically and practically very complex. How to do it, how to recruit samples like that. So we went this way, okay? But it is an important limitation, and not just a technical limitation. And I think we, for example, in the Holocaust study, we learned a lot about human resilience that you would not learn if you would base all your research on survivor organizations and clinics that serve Holocaust survivors. I don't know if I can take that experience and transpose it or apply it equally to this kind of population. There are similarities, there are differences, it's complex. But I think it's a very important thing to just keep in mind. Yes?
Quickly, so the ones that you recruited not through those kinds of organizations demonstrated more resilience than those that were identified?
Yes. Yes.
Wonderful.
Yes. Tremendous, more resilience and lack of intergenerational transmission. Lack of intergenerational transmission.
Fascinating.
This thing that we know that Holocaust trauma is transmitted from one generation to the next is true in samples that are recruited in what we call convenience samples. When you do the hard work of recruiting people in other ways, suddenly these results disappear. So that's another topic, another talk, very interesting. So I'm wondering about what, I'm wondering the same question about this sample here. I don't know the answer to it, but at least we can raise the question. So a comparison group, who will be our comparison group? And we chose the friends of these women. So to have women who are similar in many characteristics, but who don't know, of course, our subject, our participants, but have many other shared characteristics. So they're friends of friends. That's the way we did it. And their ages ranged from 34 to 60. The children's ages ranged from 11 to 17. That's the nice thing about Insightfulness assessment. You can do it on many different ages. The mothers, in general, had 15 years of education on average, had a wide range of occupations. This is not a high-risk sample demographically. So this is educated women, less educated women, not high risk. We have lots of information about the abuse they experienced, and a lot of it was inside the family, fathers, brothers, and ranging from, I hesitate to say this, but less severe to more severe. It's a big issue. What does severity mean when you talk about trauma? But, okay. In addition to sexual abuse, many of them experienced physical abuse. 53 in the trauma group reported physical abuse. 60% confided in their mothers, but only 10%, 3 of the 30, reported their mother showed acceptance. The remainder blamed the victims or expressed indifference. So this is a picture that we are all too familiar clinically with in these kind of situations. So the groups are matched. The sexual abuse group, the childhood sexual abuse, the CSA group and the other group are matched on all these various demographic variables. And what did we assess in them? We used the adult attachment interview to assess the resolution of the diagnosis. The resolution of the trauma. I'll explain about that in a minute. We used the Insightfulness assessment and also other self-report questionnaires for symptoms. I'll get back to that in a minute. So a minute of explaining about unresolved loss or trauma in the adult attachment interview. I don't know how much you're familiar with the adult attachment interview. It's a very, very well-known and established tool. An hour-long interview with the parents that assesses their current state of mind in relation to their childhood experiences, the current state of mind, not what happened to you, but your position right now with regards to what happened to you. And for us today, I'm going to focus on one dimension that is not the state of mind, but is what's called the assessing unresolved loss or trauma in the adult attachment interview. And the way you do that is, this has to do with specific linguistic markers when you ask the parent about trauma or loss in their childhood. And there are these very subtle but profound lapses in the monitoring of speech or in the monitoring of thought that happens specifically when the parent is talking about trauma or loss that they experience. Not elsewhere in the interview, only here. Subtle markers, primarily linguistic. Very interesting that apparently this is so revealing of a difficulty of integrating that experience into the life narrative. And you can classify the parent as resolved or unresolved. A lot of validity information that shows that this linguistic, almost cognitive phenomenon is actually profoundly related to disorganized attachment in the child. So we ask ourselves, First, are mothers who experience childhood sexual abuse more likely to be unresolved on the AI, what I just described, than mothers who did not experience childhood sexual abuse? And this is the result that you get. So in the trauma group, of the 30 mothers that experienced abuse, 19 of them were unresolved with regards to this abuse. Again, we don't know if this high number is because they are in treatment, whether mothers who experience the same thing but are not in treatment, are they more resolved, less resolved? We don't know. In the comparison group, we also have mothers who are unresolved, because you can be unresolved with regards to other experiences. None of the mothers in the comparison group experienced childhood sexual abuse, but they experienced other kind of, in fact, they didn't experience traumas, they experienced losses. And 5 of them were unresolved with respect to their losses. So you have a few unresolved mothers in the comparison group and many, many more in the trauma group. And this is all unrelated to the various kind of control variables that we included. So what about the link to insightfulness? This is the basic idea. This is the ghost in the nursery idea. That somehow, if you experience abuse, even many, many, many years ago, when it comes to thinking about your child's inner world, you will have difficulties. And this is what we find. So on the right, you see the scores. This is a continuous insightfulness score that we use here, not a categorical, but continuous, which is much better for clinical studies. I can explain why. Their scores of insightfulness are significantly higher than the scores of the mothers who did not experience abuse. And this is controlling for years of education. It turns out that education may be kind of an angel in the nursery. Education is a protective factor. Mothers who are more educated have higher insightfulness scores, and this is unique to this sample. We didn't find it in our ordinary sample, so there's something to talk about here about what this maternal education thing means. But anyway, statistically speaking, this difference is after controlling for that. What might account for these differences? So before we talk about childhood sexual abuse, maybe it's current symptomatology, other things that are going on that can account for these differences. This is the first thing that a researcher will ask himself. And indeed, you find big differences, as you might expect, between the two groups, the childhood sexual abuse group and the other group, in terms of this TEQ is a trauma questionnaire, the BSI is a symptom questionnaire, the DES is a dissociation questionnaire. The mothers in the sexual abuse group have much higher ratings on these things, but all of them are not related to insightfulness. So they cannot explain the differences in insightfulness between the groups because they're unrelated to insightfulness. So this is important. Okay, so this insightfulness measure is not simply a long-winded way to describe that if you're depressed, or if you have more dissociative symptoms, or if you experience more cumulative traumas in your life, you are more poor in speaking about your child's internal world. Okay? No. These are all, those are important things. They probably influence how you're doing, but they're not the explanation for why you are more or less insightful with regard to your child. So we move on to the main question, the ghost in the nursery question, if you will. Is resolution a buffer against lack of insightfulness? So are mothers who experience trauma but are resolved, are they higher in their insightfulness than mothers who experience trauma but are unresolved? And the answer is yes, because otherwise I wouldn't come here and make a big talk about all of this. So this is what you see here. So look just at the left-hand side. This is the sexual abuse group. And on the right side, the tall bar, is the mothers who are resolved. And the short bar is the mothers who are unresolved within the trauma group. Okay? And you see that's the buffering effect. That means that if they are resolved, or as Mary Main will probably say, not unresolved, because the markers are lack of resolution. So there's absence of markers of lack of resolution in your interview, in your adult attachment interview about your childhood. Then you are better at being able to talk about your child's internal experience, what's driving your child's behavior. Essentially, you're more insightful. And if, on the other hand, you show markers of lack of resolution when speaking about something that happened many, many years ago, somehow this trickles into your capacity to look at your child's internal world. So that's the left-hand side of this slide. Let's talk for a moment about the right-hand side of this slide. So these are mothers who did not experience any abuse. So in fact, it's a regular sample. And for some strange reason, the resolved and unresolved mothers look the same. Now, this is strange for us attachment folks because these are mothers who are unresolved. Okay, they're unresolved with respect to losses that they've had, not with respect to trauma. So that might be one explanation for why you don't see any insightfulness differences. So in the world of attachment, unresolved is a general term, irrespective of the unresolved of what, if it's trauma or if it's loss. Both of them are grouped together. But maybe this is showing us that lack of resolution with regards to trauma and lack of resolution with regards to loss, in terms of parenting, might be different stories. Okay, if you look specifically about parenting. The other thing, which is kind of a methodological point, there's only 5 mothers in this non-CSA group who have lack of resolution. So you can see this, that the most rightmost column there the scores are based on 5 mothers. The left column is on 25 mothers. So, when you have just 5 unresolved mothers, we're much less confident about what that means. So the left side of this slide is exactly what we expected to see, and the right side raises interesting things about different types of losses, different types of resolution with respect to resolved with respect to what. Okay, the other slide, the other way to look at data like this is a bit confusing, I apologize, but I want to stress this point. Now it's broken, resolved, unresolved. Before it was abuse, non-abuse. Now it's resolved and unresolved, and within each group, the differences. And what you see on the left that's really important for us is the lack of differences. So, mothers who are resolved, whether they experienced trauma or did not experience trauma, don't look any different with respect to their insightfulness. Okay, that is another way to say the same idea. Okay, the same idea of buffering. So when you're buffered, the effects of the trauma are no longer evident in the way you are speaking about your child. And although it seems like there is a difference there, it's not a significant difference. Okay, so that would be great. We have 4 more minutes. So to conclude, what did we find? Mothers who experienced childhood sexual abuse are less insightful with regard to their children than those who did not experience childhood sexual abuse. Now, this is a nice confirmation for these basic ideas that came from clinical work. But I want to emphasize that this is not at all a trivial finding. This is a very significant finding. Because we're talking about mothers' current speaking about her child's experience, many decades after there's no longer sexual abuse or any abuse going on, and yet, and not asking her about abuse, asking her to talk about the child's behavior in regular, not stressful circumstances. And even under these conditions, we see the effects of those traumatic experiences still evident in the organization of her speech. This is not explained by the suspects, the usual suspects, the things that you might first raise and say, of course, because they have that trauma in their background, so they have more symptoms, more dissociation, more of all of these things. that does not explain this. So there's something more specific here, and that's really important, I think. And, of course, the main point here, when the mothers are resolved with respect to the trauma or not unresolved with respect to the trauma, they're no different from a group of mothers who have not experienced any trauma in their background. So the buffering effect of resolution is evident in mothers' insightfulness with respect to their children's experience. So this leads to the next million-dollar questions. Why is it, or how is it, that some mothers are more resolved and some mothers are less resolved with respect to such horrific things like childhood sexual abuse? What is it that explains that? And in fact, we know, I think, much less about that from attachment research. We know more about that maybe from resiliency research. But what is it? What is it that enables some mothers to speak about these horrible events that happen to them without losing the capacity for coherence, without showing these lapses in the monitoring of speech and the monitoring of thinking that are characteristic of unresolved mothers? What is it about these mothers? That would be a wonderful thing to know, of course. That factor that helps them integrate these experiences. And of course, obviously, that's what a lot of interventions try to do. And I want to... and another very important question is this, the second to last on this slide. You might ask yourself, well, David, this is all about how they speak about their child's internal experience, and resolution is measured by how they speak about their childhood experiences. But what about their actual behavior with their children, their actual interactions? Does this get translated into actual interactions with the child? And the answer is yes, in two ways. One is we have lots of evidence about insightfulness and how it gets translated to actual parent-child interactions. Lots of evidence about that, with mothers, with fathers, with couples, with samples with needs, special needs, and regular samples, and so forth. So we can rely on that to know that this translates. But also in this sample, we have a whole other piece of this research where we ask these mothers to have emotional dialogues with their children, talk about the children's emotional experiences. And when you look at the mother's behaviors, their interaction with their children in those contexts, you can see the expression of the insightfulness or lack of insightfulness in the actual interactions with the child. But this was too much to squeeze into today's presentation, so I'm just, giving you a little bit of a
preview of coming attractions for next year.
Perhaps. So I thank you very much.
Is it published?
This specific work was this morning. I just got news that it was rejected from a journal. I won't mention the name of the journal, but it was rejected. So it's very hard work to get this work published. So it's currently not published yet, but we will not give up and continue with efforts to publish it.
Unfortunately, we have another class coming in, so we're going to have to.
Thank you.
But maybe we can